First of all, I will not remind you that the colorectal cancer is the third one in the world by its incidence, prevalence. What we can expect in the next few years, it's a rising in both incidence and mortality due to this factor aging and westernization. We can try to have this early detection to decrease the mortality and to also try with colonoscopy to decrease the prevalence of the disease via adenoma detection and removal. Screening strategies vary. Some use direct colonoscopy, mainly from population from 50 to 65 or 70 or 75. And in North America, they go to an early beginning according to the new epidemiology with beginning at 45. It is not yet cost effective to start early in all countries at this time, but maybe this figure will change. Screening is not the only option. We have also the possibility to activate primary prevention and so to activate modifiable risk factors. In this case, we have a lot of literature, a lot of studies that it's not so easy. So there is this world communities at work in continuous analysis to provide up to date. And it underlines some of these factors that decrease or increase the colorectal cancer risk. If we go on more detailed way, we can see that physical activity is an important factor. And for example, each time you spend 2 hours per day at your desk, you increase your risk by mainly 8%. On the other hand, if you add only 3 additional hours of working per week, you decrease this risk by 15%. So I think every consultation and also when you are asked for question or for publication or for communication, this important message have to be released. And it is the case not only because of this colorectal cancer issue, but for other cancers and other diseases, including cardiovascular conditions. When we go to other factors, obesity is an important one, mainly abdominal obesity, which increases the risk with a relative risk of 1.1 or more. Another point, and independently of obesity, physical activity, and diet, is diabetes. Diabetes, it's more than 5% in Western countries, and the relative risk is 1.2. There is no specific increased risk with insulin, but there is a decreased risk with metformin. But there is few of these studies for colorectal cancer patients or patients at risk of colorectal cancer. And when we can analyze the literature, we can see that we can induce some changes in alcohol, smoking, fiber, red meat, and processed meat consumption. So it's not nothing. Maybe we can have to enlarge these studies to know more and how to do more efficiently the changes. It is important because when we can have a changes, we can have a change in the colorectal cancer risk. Like I said, it is possible to avoid developing colorectal cancer. We can activate screening, we can activate primary prevention, and it is still a very difficult task, but a very efficient work to do, and we have to improve our action on that.